My name is Rebecca Leon and I'm a GP. In this series, I'm going to investigate how frontline primary care can support people affected by cancer, how to improve relationships between primary and secondary care, and most importantly, how to maintain a patient-centred approach. Today, I'm at the Christie, home of the first high-energy NHS proton beam centre here in the UK, to speak to people involved and to find out more. Proton beam is a type of radiotherapy that uses a beam of high-energy protons to treat specific types of cancer. It does this by precisely targeting a tumour, which reduces damage to any healthy tissue and vital organs. I met up with Dr. Ed Smith, consultant clinical oncologist at the Christie, to find out more about proton therapy, who is eligible and potential side effects. Which patients are eligible?
Those patients that benefit from protons, they tend to either be very young patients. So I mentioned that the proton dose is delivered around the tumour and less into the normal tissues. Well, of course, young people are growing, and if you can avoid giving radiation to normal tissues, then you can reduce the risk of late effects in the future. You could be treating near critical tissues in the brain and be able to avoid those tissues that are responsible for memory and IQ in the future. In the pelvis, you may be able to avoid an ovary or the uterus, which obviously has different advantages for those patients. So generally young people. There's another group of patients who have tumours next to critical structures that actually prevent you from giving curative doses of radiation therapy to them. So these could be tumours next to the spinal cord, next to the brain stem, for example. And if you were to use conventional X-ray based treatments, you would exceed the radiation tolerance of those tissues and they would come to some harm. With protons, however, you can not only deliver what you could have delivered with X-ray based treatments, but actually give more of a dose. And for those tumours that show a dose-response relationship, so the higher the doses, the higher the cure rates and local control rates, protons plays a very valuable role.
What are the common side effects in proton beam therapy?
It depends on ultimately what part of the body you are treating with the radiation therapy and what tissues are receiving radiation dose.
Conventional radiotherapy delivers beams of photons to the tumour and beyond, potentially damaging nearby healthy cells, which can cause side effects. In contrast, proton beam therapy differs to conventional radiotherapy through its dose distribution. Protons deliver the highest amount of damage when they stop, which is called the Bragg peak, enabling a more precise target to the tumour site. This can cause less damage to nearby healthy tissues, causing fewer side effects. A further driver behind proton beam therapy is the fact that less healthy tissue is damaged, and therefore there is less risk of secondary malignancy rates in the future. I spoke to Sarah and Alan, a young patient's parents, to gain an insight into their experience of proton beam therapy. So when Oscar was first diagnosed the middle of last year, how were you told and how did you feel when proton beam was an option for treatment?
Well, initially we didn't realise that it was an option. We thought there would be a period of surgery to remove as much of the tumour as they can, and then standard radiotherapy near where we live in Sutton at the Royal Marsden. So I think when we heard that proton beam therapy might be an option, we were quite surprised, weren't we?
Yeah, so it was only after all the surgery side of things that you start thinking about what comes next, and then people started talking in more detail about what would come next. And yeah, as Sarah said, we didn't really know anything other than radiotherapy was an option. So it was all new to us.
Did it come as good news? Or did it come as?
I think once we'd then done a little bit more research and found out that it was a sort of cutting edge technology, and that people were really sort of wanting to use this treatment on tumours such as Oscar's, then we were really sort of excited about the prospect. But there is a phase where you don't know, because you get referred to a proton panel, so you don't know necessarily whether you're going to be accepted or not. So we were a little bit cautious about getting too excited about the possibility of proton beam, because actually normal radiotherapy would have been fine. It's just this was a sort of bonus if we could get it.
I also spoke to Oscar to find out how he found the experience.
Hi Oscar, thank you for coming to chat to me today. So first of all, how are you? How are you feeling?
I'm pretty good, thanks. Yeah, I've been out and about, running.
Good.
The only time I've been feeling tired for treatment is straight after, like half an hour after I need to sit down before we go back to our flat.
So where are you up to now in your treatment?
I am day 17, I think.
And how many have you got altogether?
30.
So you're not getting any side effects from the treatment?
Not particularly.
Good.
Apart from I feel a bit tired straight afterwards.
Okay. How did your friends react? Did they have lots of questions or were they nervous?
Both classes had quite a few questions actually. Someone said, "What is it?" And I was like, "No idea."
Okay.
Somebody asked, "Can you catch it?" And I was like, "Don't think so."
Okay. So it's good that actually they could ask you questions, and at that time you didn't even know what it was. Thank you so much, Oscar, for talking to me today. I've really enjoyed that. Thanks.
The future of proton beam therapy is exciting. It is widely accepted that in the paediatric setting, this is the gold standard of care. However, with adults, I've learned that we need to have further clinical evidence from clinical trials to see who would benefit from proton beam therapy.